The significance of the study, the scope and delimitations, and the definition of terms are three sections that may seem straightforward at first glance, but they carry immense weight in establishing the credibility, clarity, and direction of your research. They tell the reader why your study matters, how far it extends, and what its limits are, and also how to interpret the terms you use. Without a strong grasp of these three elements, even the best research design can fall flat. The significance of the study is what makes your research valuable, and it gives the reason why it deserves attention. It explains the value, impact, and relevance of your research. As researchers, one of the first things we must articulate is why our study matters. The significance of the study helps readers understand the practical and theoretical contributions of the research. This section goes beyond merely stating that a problem exists. It answers the deeper question: so what? It connects your findings to broader concerns in nursing practice, education, and policy. It provides the justification for why the research was worth doing and why readers, including the panels and funding bodies, should care. Now, your significance of the study answers the questions: why is this study important? And to whom does it matter? Here, you are prompted to reflect on the potential change your study can influence. This question draws attention to both the scope and the stakeholders of your research. It reminds us that no research exists in a vacuum. It should matter to someone, and ideally, it should have ripple effects across sectors. Now, let us identify the specific individuals or groups who stand to gain from your research findings. You identify stakeholders that are affected by the study. For our sample study, the stakeholders could be student nurses. Student nurses can benefit by gaining insights into real-world applications of theoretical knowledge. Your research might inform their learning, awareness, or future practice. The clinical instructors. They can use your findings to adjust evaluation tools, enhance instruction, or focus on areas where students commonly struggle, ultimately improving the clinical learning experience. Academic administrators. These leaders may utilize your study to shape institutional policies, evaluate curriculum effectiveness, or propose strategic educational reforms. Healthcare institutions. Hospitals and clinics may benefit from recommendations that improve patient care processes, infection control, or staff training. Community or patients. If your research leads to enhanced nursing care or education, patients and the public are the ultimate beneficiaries. Safer, more competent care benefits everyone. Beyond naming your stakeholders, it is important to explain why your research will make a positive impact on each of them. For the students, they can gain awareness or training support. By identifying gaps in knowledge or skills, your research can suggest targeted training or educational strategies to address these deficits. For instructors, they can improve teaching and evaluation. Instructors gain empirical feedback on their current teaching methods and can redesign them based on what works and what doesn't, grounded on evidence. Schools inform policy or curriculum revisions which your research may reveal, such as systematic trends that call for changes in course content, clinical requirements, or student assessment methods. Your study can benefit hospitals or communities by guiding safety protocols and also education for institutions that may use your findings to revise their standard operating procedures or improve health literacy programs in the community. How can your study add to the academic body of knowledge and support institutional or scholarly goals? This could add to local literature and evidence based practice. This is essential in settings where contextual studies are limited. Your research enriches local databases and informs culturally and regionally relevant nursing practice. It may serve as a foundation for future studies. Studies that explore under-researched areas often spark follow-up questions. Your work becomes a stepping stone for future researchers to build upon. Supports the institution's research agenda. Many colleges aim to strengthen evidence-based community rooted research. Your study aligns with these goals, especially if it is grounded in institutional research priorities. Now, what about applying your findings to real world nursing practice or policy development? Your findings can lead to better infection control policies. If your study investigates compliance or knowledge gaps in infection control, it may directly inform and improve policy measures in clinical settings. Modified student evaluation systems. Research highlighting flaws or strengths in current assessment tools can lead to a more accurate, fair, and effective evaluations for students. Data-driven training designs. Training programs tailored from real data rather than assumptions will be more effective and efficient. This is a key application of your study's findings. Your study could also help close the theory to practice gap. Bridging this gap is a recurring issue in nursing education. Your research could validate classroom concepts in real practice or reveal where disconnection exists, guiding needed reform. Here is a practical guide to help you write a strong significance section using a structured flow. Identify the stakeholders. Start by naming the specific individuals or groups who will benefit from your study. These are your stakeholders. Think broadly. Your audience may include student nurses, instructors, academic institutions, healthcare workers, patients, or even policymakers. Describe how the findings will help. For each stakeholder that you mentioned, explain what they stand to gain. Use clear, concise statements that link your findings to their needs or concerns. For example, if your research explores student nurses' compliance with infection control, describe how this will benefit hospitals aiming to reduce hospital-acquired infections. Separate academic versus practical impact. Distinguishing between academic contribution, such as adding to nursing theory or research, and practical application, such as influencing clinical practices, strengthens your significance section. This dual lens reflects the comprehensive value of your study. Use subheadings or separate paragraphs to make the distinction clear. End with a broad statement of value. Wrap up with a conclusive statement. This might be a reflection on how your study contributes to evidence-based practice, supports national health priorities, or aligns with your institution's research agenda. Make sure this part ties back to the importance of nursing research in improving healthcare outcomes. Moving on, let us define the boundaries of your research by clearly stating what your study will cover. This is included in the scope of the study. The scope of the study describes what your study includes. The scope is essentially your research's fence. It draws the line between what you are studying and what you are not. It provides readers with a snapshot of major elements: who, what, where, and when. It tells us what variables are involved, the methods you plan to use, and the context where the study will happen. What are the common elements in the scope of the study? The population. You specify who your participants are. Are you focusing on level 3 student nurses, on clinical instructors, on hospital staff? The setting. Where is the study taking place? At a university or college, at a hospital or an RHU, or the community? Be specific. Time frame. Indicate the period the research will be conducted. The variables studied. Mention what you are measuring. The design or the method used. Briefly state whether it is quantitative, qualitative, or mixed methods. Delimitations distinguish what your study intentionally excludes, based on your chosen research design and focus. Delimitations are choices you made that limit the scope. They are not flaws. They are purposeful boundaries. These reflect your conscious decision to focus your study. For instance, you might choose to survey only level 3 student nurses due to feasibility or because they have the most clinical exposure. These are your delimitations. Reflect what the study intentionally excludes. The limitations also clarify what your study will not cover. You might not include students from other levels, other schools, or non-nursing programs. Stating this prevents misinterpretation and manages expectations of your findings. What is the importance of defining the scope and the limitations? It helps define the boundaries of the study. By clearly stating your scope and the limitations, you help reviewers understand what your study includes and excludes. It creates a framework for interpreting your findings properly. It prevents assumptions and clarifies what generalizations, if any, can be made. It prevents overgeneralization. Without boundaries, your findings might be misapplied or overstated. By being transparent about the limits of your study, you demonstrate academic honesty and protect the credibility of your conclusions. It aids in panel evaluation and review clarity. A well-written scope and delimitations give your panels, the ethics boards, and peer reviewers a clear sense of the study's feasibility and design logic. How to differentiate the limitations and limitations. The limitations are within your control and arise from the conscious choices you made in your study design. For example, if you choose to focus only on level 3 student nurses, that is a delimitation. It means you are deliberately narrowing the focus to a specific group or reasons for reasons such as feasibility, relevance, or access. These decisions must align with your research questions and objectives. They help make your study more manageable and targeted. It is important to explain why these choices are made to demonstrate thoughtful planning and coherence between your research and focus. Unlike the limitations are constraints imposed by circumstances you did not or cannot control. This might include a small sample size due to low response rates, difficulty in scheduling clinical observations, or possible bias in self-reported data. Acknowledging limitations doesn't weaken your study. It actually strengthens your integrity as a researcher. It shows you are aware of the study's potential weaknesses and are transparent about how they might affect your findings. Always consider how limitations might influence data interpretation and suggest how future researchers might address them. Here is a sample of how to write the scope section clearly and concisely. This study focuses on Level 3 BSN students of College A during their clinical duties in school year 2024 to 2025. It measures their knowledge and compliance to infection control practices. This example shows a clear population, a specific setting, a defined time frame, and the focus variables. It is concise, specific, and avoids ambiguity. Always aim to replicate this level of clarity in your scope writing. Let us now look at an example of how to present the limitations relevant to your nursing sample research. The study does not include students from other year levels, non-nursing programs, or clinical duty locations outside of CTX. It is limited to self-reported knowledge and observed compliance. This sample clearly states who and what is excluded from the study and why. This helps avoid misunderstandings and sets expectations about how the results can and cannot be generalized. Always support your delimitations with logic grounded on your study's goals. Here are several tips to keep your scope and delimitations aligned and purposeful. Be specific but not overly technical. Avoid vague phrases like some nursing students or various settings. At the same time, don't overload your scope with too much jargon or complex variables that will confuse your readers. Use terms your audience understands. Avoid apologizing for delimitations. Don't frame your delimitations as weaknesses. Instead, frame them as purposeful decisions that will help sharpen your study's focus. Connect choices to the study purpose or feasibility. Explain why you made these choices, whether due to time constraints, accessibility, or relevance to your population. This builds a rationale that reviewers appreciate. Here are some common pitfalls to avoid when drafting your scope and delimitations. Making scope too broad. A broad scope can dilute your focus and make your study harder to complete within a given time frame. It may also make your results harder to interpret. Narrow it down to what is feasible and aligned with your objectives. Treating limitations as delimitations. Don't confuse what you chose to exclude or delimitations with what you couldn't control or limitations. Mixing them up reflects poor planning and can confuse your readers. Not explaining why certain groups or settings were excluded. Every choice needs a reason. If you excluded a group or setting, explain why. Was it due to ethical clearance, lack of access, resource constraints? Providing a reason shows thoughtful planning. Now, let us define why it is important to explain technical terms or variables in your research. This is found in your definition of terms. This is the section where you explain key concepts, technical terms, or variables used in your study. This section acts like a mini dictionary specific to your research. It ensures that everyone, your panelists, ethics, reviewers, readers, and even future researchers understands exactly how you are using certain terms. This is especially important in nursing research. where common words like compliance, knowledge, or hygiene can mean different things in different contexts. Clear definitions establish consistency throughout your proposal and avoid confusion or misinterpretation. Ensures clarity and consistency. The definition of terms helps readers understand exactly what you mean. Your goal is to remove any guesswork for your readers. Do not assume everyone has the same background or interpretation. Even among nurses, terminologies can vary depending on specialty or experience. It is also useful for panelists and ethics reviewers to read and go over your well-defined terms section. This saves them time and helps them evaluate the clarity, appropriateness, and rigor of your study. It also supports your ethical approval by clarifying how you are explaining sensitive or clinical concepts to your participants. Let us now differentiate between defining a concept theoretically and defining it for practical measurement. Conceptual definition is the theoretical meaning from books or experts. This is how a term is understood in the academic world. For instance, you might read that compliance means or refers to the extent to which a person's behavior corresponds with agreed recommendations. This helps position your study within a scholarly framework and are often found in books or journal articles. On the other hand, operational definition refers to how it is measured or applied in your study. The operational definition is grounded in action. It answers, how are you going to observe or measure this concept in your study? So if your conceptual definition of compliance is about following hand hygiene protocols, your operational definition could be compliance will be measured using a 10-item observation checklist. So to show how a term can be defined conceptually and operationally within your study, example, you are defining compliance conceptually. You can define it as adherence to guidelines, and compliance, your operational definition, the total score from observation checklist. This example demonstrates the dual purpose of definitions. First, you tell your readers what the concept means in theory. Then you explain exactly how you will use and measure it in practice. Having both forms of definition ensures your study is rooted in literature and aligned with your tools and objectives. Always write your definition of terms in a sentence. How do you organize your definitions? You can arrange it alphabetically or by order of appearance in the text. There is no fixed rule for organizing your terms. What is important is consistency. However, listing them alphabetically makes it easy to scan. Organizing by appearance in the text can help the reader follow your flow of ideas. Choose the format that fits best with the length and complexity of your study. And of course, check your institutional format. How to write the definition of terms. Do not forget to craft strong, clear definitions that align with your study framework. Use credible sources, such as APA citation or according to your institutional guidelines. For conceptual definitions, rely on literatures, textbooks, research journals, and reputable organizations. Cite your sources in APA format where applicable to maintain academic integrity. Be clear, concise, and research-based. Do not overload your definitions with jargon or extra details. Focus on clarity and ensure the definition supports your research question and methodology. Align your definitions with your framework and tools. Your definitions should make sense within your study's theoretical or conceptual framework and match how you are measuring each variable. To summarize, do not forget these key points. First, we emphasize the importance of highlighting your study's value and relevance. The significance of the study is where you communicate not just what your research is about, but why it matters to nursing students, instructors, institutions, and to the broader healthcare community. It is where you demonstrate the academic and practical contributions your study can make. Second, we talked about the need to set clear scope and justified boundaries. Your scope and the limitations help readers understand what your study covers and what it doesn't. Framing your research within manageable, well-defined parameters helps clarify for ethical review and helps avoid misinterpretation of results. We also discussed how to define terms for clarity and consistency. The definition of terms ensures everyone understands your key concepts in the way you intend. By distinguishing between conceptual and operational definitions, your study's strength towards the tools, framework, and overall research design is enforced. These three sections, the significance of the study, scope and the limitations, and the definition of terms, form the backbone of a credible and coherent research proposal.